724 is your time. Because of the coronavirus crisis, family members of loved ones suffering from COVID-19 and still so many cases that can't visit them. And it makes it very tough for family members to make these surrogate decisions for patients too sick to speak for themselves. There's a new study by Regan Street Institute showing that nearly half the time medical treatments given to those patients didn't match the goals requested by their loved ones. That's a lot, half. Joining me live with more on this really alarming study is Regan Street researcher Dr. Alexia Torkey. Doctor, thank you so much for joining us. When you hear that statistic, wow, I had no idea that it was that high. Can you just tell us a little bit about what went into this and how you guys came up with that, kind of those numbers?
Yeah, we studied over 350 older adults who were admitted to hospitals in downtown Indianapolis. And we found, we asked each family member who was making decisions what they thought the best goal of care was for the patients. And then we tracked the patient's care that they received during the hospital stay. And there were a lot of mismatches. The most common one is when families thought that the patient should really be receiving care focused on comfort. But many of those patients had orders for what we call full code status, meaning they get the most aggressive care in the state of an emergency. And we think it's really important that families understand what goes into aggressive life-sustaining treatment, that they have a chance to talk about this. And I think communication just breaks down sometimes in these difficult situations.
Yeah, we have a friend of the show who actually, I haven't gotten back with him because he called me late last night and left a message saying that there were restrictions being lifted so that he thought he was going to be able to go in and see his wife, who has a really severe form of cancer right now. And then things changed all of a sudden. Now he can't get in. Are you seeing that the rules are being laxed at all, where we're now starting to see people be able to go in, or are we still relying on doctors and nurses here without family members being able to talk to the patients?
Well, as we learn more about COVID-19, hospitals are making changes, and I think in most cases are allowing more liberal visitation. I mean, I think anyone who has a loved one in their family who is in the hospital sick should certainly ask, should certainly request a visit. It might be limited in the number of people who can go, but there certainly are more circumstances where families are being allowed to visit the patient in the hospital, and I think that's so important for the patient's well-being. If the patient isn't aware of their surroundings, for the family's well-being. And so I think it is, hospitals, I think, are working hard to relax those visitation rules and give family members the opportunity to come in whenever possible. So I'd certainly encourage a family member to at least ask.
Yeah.
I know it's heartbreaking when families can't be at the bedside. And so to advocate for themselves is something that's really valuable and important.
We're out of time, and I just, we can't talk about this, but I just want to at least say it, just to make sure that, you know your wishes before you go in, and maybe have that signed, paperwork now. We all should know, if we're in this situation, what do we want to have done, and have that in writing. Doctor, we appreciate it. Thank you so much.
Thank you.
Absolutely. 727, Ray.